Elizabeth. We're here again for a very special, with a very special guest who's been in our paper, likes our paper, we think, and is just also a really very special organization. We have here with us Elana Silber, the CEO of Sharsheret, which is, I actually consider you a local organization for us. I hope I know Sharsheret's a lot bigger than just, our core readership, but I look at you as a kind of a real local organization. Please tell me how wrong I am about.
You're right in that the way Sharsheret operates, wherever we are, people think of us as a local organization.
Good.
Because of what we do is so personal and personalized. So anyone who's reaching out to Sharsheret for support, someone who's facing breast cancer, ovarian cancer, carrying a BRCA mutation or other mutations, they feel like we're right there. A lot of the work that we do is remote, but you are right also in that Sharsheret really started here in Teaneck, New Jersey. We started as a national organization, but historically, Jewish national organizations were based in Manhattan, let's say. Ours, right, being local members of the community, and also for the less expensive rents at the time. People were working in offices then. This made a lot of sense, and the community came out in full force of support of Sharsheret. So we are very grateful for the local community here in Teaneck, and really, extending to the tri-state area, Westchester, and other communities that have really were instrumental in getting Sharsheret off the ground and helping us grow to where we are today, which is really international. We have 5 offices in the United States, one here in New Jersey, one in New York, one in Chicago, LA, South Florida, and now in Israel. So our offices, our staff are based in those areas, but we have volunteers and supporters in all 50 states of the country and in Israel, and then some volunteers in other countries that are benefiting from Sharsheret, but we don't have professional staff in those other countries, only in Israel and the U.S.
Mm-hmm. Yeah. So, by the way, I just want, I remember the founder, Rochelle Shoretz, was a very, very special woman, and I think in the early years of the Jewish Link, she passed away now 10 years ago, I think. So the paper is now about 13 years old. We're reaching our bar mitzvah. And I remember meeting her. I mean, I knew her, but actually this kind of gets to your story. Was founded by a very special woman, Rochelle Shoretz, who made a tremendous impression upon me when I met her, when I knew her. But, Let's go. Let's start from Rochelle Shoretz.
So the truth is, you and I, we've been very privileged to know Rochelle and really learn from her and work with her and be friends with her. The way I met Rochelle, I was a Sharsheret volunteer. I had heard Rochelle speak. She was a 28-year-old woman. She was a rising attorney. She clerked for Supreme Court Justice Ruth Bader Ginsburg, the first Orthodox woman to clerk in the Supreme Court. Actually gave Ruth Bader Ginsburg a mezuzah, which was the only mezuzah in the Supreme Court, and she had written about it in a New York Times editorial. So she was an otherwise healthy young woman when diagnosed with breast cancer. Really looked in the community for support, the Jewish community, the cancer community, and really no one could address her issues as a young mom, as a wife, as someone with a rising career on how to manage. There were many offers to speak with grandmothers, great aunts, cousins who were older. But then she was fortunate. She was introduced to another young woman. Her name is Lauren Weiser. She was 30 at the time, I think. A little bit further ahead in the breast cancer experience, and she was introduced to her. And Lauren, who lives in Westchester, really carried Rochelle through those days, through the harrowing days before surgery as she went into chemotherapy. And then they looked at each other and they said, we can't be the only 2 young Jewish women. I mean, really, Rochelle took the lead on this and said, what if we start an organization we can help 5 women a year? Fast forward now, we're 24 years later, and we're helping, thousands, 37,000 individual women, 275,000 with families. And they got it off the ground. And so it was a very grassroots organization, and she was always looking for volunteers. So speaking in local shul. So I go to B'nai Yeshurun, and she was speaking in my local shul. And hearing her speak about this and that breast cancer and now ovarian cancer, and then not just a Jewish woman's issue. It's a Jewish family issue. It's a Jewish community issue. And sitting there in the audience, I said, how could I not get involved? So I started to volunteer. And then ultimately, she approached me and said, I think Sharsheret's going to grow. It's not just going to be me. I have an MBA in healthcare. I have pretty good connections in the Jewish community. So it's kind of how do you grow an organization with those 2 and this health interest that I've had always. And I said, yeah, I'd love to. I was looking for something at the time that was meaningful. I had been living in London for a few years, and this was just like, seemed perfect. And we started working together as colleagues and ultimately became really close friends, maybe, the best of friends, but remained very professional. And really, I helped her grow the organization, which, people thought maybe was her story, but we worked very careful to make Sharsheret the story of every woman and man and family that reaches out. And unfortunately, when she passed away 10 years ago, that's when the test was there. Would people still be able to benefit from the services that Sharsheret offers once Rochelle or Ruchi had passed away? And, sitting here 10 years later and seeing the organization grow exponentially, the need is there, the demand is there, and people are benefiting every day. We're improving lives and saving lives based on her vision and her mission, but really taking that to the next level and adjusting to modern times to address what people really need now, today, and for the future.
So you were employee, number 2, 3, 4, 5?
I was employee. I think there was a part-time admin, and I was the first professional employee. Because I think once I became an employee of Sharsheret, then Rochelle also became an employee and no longer a volunteer. But many of our people on staff started as volunteers, and we recruited them to staff. So,
and we're also here because it's October, and it is Breast Cancer Awareness Month. I know that Sharsheret does not only address breast cancer issues, but we talk about what the month means and what kind of special activities you might have as sort of just a beginning point for the massive, global operation that you're running now as well.
So the truth is that breast cancer does get a lot of attention in research. There's something, I guess, sexy about pink, whatever it is, in women.
Pink.
Pink, by the way, just...
Sorry, I'm wearing the wrong color. I'm wearing the wrong shade of Sharsheret, but I tried.
Sharsheret, everyone is welcome. But it's an opportunity to really take this. It's more than just the pink in October, and it's more than the activities. It's really an opportunity to educate the community about their risk and the measures they can take today to protect their health and to care for those in their community who are struggling with breast cancer. And ovarian cancer and breast cancer, while it is Breast Cancer Awareness Month, it follows right after September, which is Ovarian Cancer Awareness Month, because there is a very strong connection. Obviously, primarily female cancers, although men are diagnosed with breast cancer at a smaller rate, but they are. But in the Jewish community, for us, the connection is even more strong. There's something called a BRCA. That's what people call it. But the real term is, it's a breast cancer gene mutation. It's called BRCA. And 1 in 40 Jews of Ashkenazi descent carries this genetic mutation, as compared to 1 in 400 in the general population. So if you are a Jewish family, you're at 10 times greater risk of carrying this genetic mutation. And what does it mean? It significantly increases your risk for hereditary breast cancer, ovarian cancer, but it doesn't stop there because men carry the mutation too. So it increases the risk for prostate cancer, pancreatic cancer, and melanoma. So it's really critical that those in the Jewish community, whether they have family history or not, consider genetic testing. Family history is the first step. Everyone who's listening today, ask your family about family history. We've been limited in previous generations because of the Holocaust. It's very hard for our families maybe to go back, certainly Ashkenazi Jews, to go back 3 or 4 generations. If your grandparents came to the U.S. in the 1940s, there's no family members. There's no one to ask. But now that we are several generations later, and cancer has been more spoken about publicly, which we take some credit for that as well. Like, it's no longer the C word. I think people are more comfortable talking about it. Know your family history. Find out. But that's not the end of the story. We have a genetic counselor. We have 2 genetic counselors on staff. Call us. It's free. It's confidential. It's from your office, from your car, from your work, wherever you are. Find out if you should consider genetic testing. Because if you carry this mutation, there are things you can do today to protect your health. There are prophylactic surgeries, there are medications, there's extra surveillance. We no longer have to wait for cancer to happen. If you carry a mutation, we can help you manage your health. And that's why it's really critical. And October is a time, maybe we take advantage that we're going into the season with the Chagim, the holidays. People spend time with family. don't put a damper on it, but have a conversation with your mother, with your grandmother. You know, maybe your grandmother had breast cancer and you've only had men in the family and nobody else has. So you think you're not at risk and you yourself are a man. But find that out, because if you are at risk for these cancers, you can do things today. And that's really what it's about. We can save lives by knowing our family history, by accessing genetic testing. It is accessible. It is affordable. There are ways you can do it, but you have to understand why you're testing. This is not a simple test, because when we're talking about genetics, it affects everyone in your family. You know, I think about like when you take a pregnancy test, you're pregnant or you're not pregnant, and, you know, that's going to affect you. But when you take a genetic test, so many family members share the same genes as you and could also be at risk. So you can imagine the information that you have not only protects your own health, but could help affect, like an entire family could benefit from it. We've seen people who find out their genetic status and share that with family members and save lives and find cancer early.
Isn't it true also that like 10 years ago, around the time when Rochi was sick, there were only known mutations of like 2 or 3 tests that could be done. And now aren't there many, many more? There
are a lot of mutations that they're attributing to breast cancer and ovarian cancer. So it's really not just BRCA. BRCA has like the highest statistics of, but there's CHEK2, there's PALB2, there's ATM, there are other genetic mutations, and the way they're reading the genetic reports are different. So yeah, you have to stay on top of it. And that's why you can call Sharsheret and speak to our genetic counselor and say, like what you're saying, maybe 10 years ago, I took the test and I heard on the Jewish Links podcast that they only knew about a few mutations.
Right.
But I see so many people in my family with cancer. Do you think I should go get tested again? Can I ask you what you think? You know, am I a candidate for that? So these are really good questions, and every single person's situation is unique and different, but also the same. Like, so you can learn from others. So I think it's really important to know that technology is moving quickly, and advancements in medicine. We're sitting in a country, we're very fortunate, that has very advanced medicine also in Israel. And this is who we know, and we can get more information. So yes, there are people that are calling every day to find out, are my tests still relevant? Should I be getting more? What do you think? And it's not just about the test, because even if you test negative, if you have a strong family history of cancer, that's worth a conversation and may also require extra surveillance or other measures to protect your health.
So, you know, do you feel like I feel like in our generation, the attitude towards cancer has changed. Cancer has gone from being the C word, almost a death sentence, to being a terrible crime, like almost like to a treatable, or in many cases, treatable if caught early. You know, do you feel that? And also, does it affect Sharsheret's work, the way breast cancer is kind of seen? I'm just wondering.
Well, early detection is the key. Early detection means cancer can be treated and it can be cured in its earliest stages. And we're very lucky because there are a lot of screening modalities out there now for, like, still the gold standard is a mammogram for breast cancer for men and women. And there are others, there are MRIs, there are sonograms, or definitely, when it comes to ovarian cancer, there is no reliable screening for it. So knowing your family history and knowing your genetic status is also very important. So we haven't really, ovarian cancer has not come that far as screening it, but there are a lot of good treatments for it. So when you talk about a death sentence, so someone who's had ovarian cancer maybe 10 years ago, like you said, they didn't think there was a lot of hope. We're seeing a lot of women on a lot of new medications who are doing very well with advanced ovarian cancer and breast cancer. And it's really important to hear, what are people doing? Things that were in clinical trial are now available to patients. So Sharsheret can help tell you what other people are doing, what's out there, educate that we host about 68 medical webinars a year on topics like, and you can pick and choose. You can come, and they're all online and they're all archived afterwards. But if you're curious about ovarian cancer, you know, is it a death sentence? What should I be doing? If you're worried about early detection for breast cancer is key. We know people who are, you know, they find out they have breast cancer. Not everyone has the same protocol for their treatment. Some people will need chemotherapy, but now they have tests that can say the likelihood of recurrence might be so small you don't need to have chemo. And I think chemotherapy has become, you know, the sign of cancer, right? If you lose your hair. But, you know, there are plenty of opportunities to have good treatment that maybe don't have that side effect. So I think people are talking about cancer more. I think social media has done a lot with that. And I think more young people are diagnosed with cancer than there were before. or sick
And that's
more.
because of early detection, not necessarily because of...
If we knew the answer to that, I think we would be very focused. I think it's a combination of things. We don't know, and we don't know for sure, but definitely early detection is helping catch cancer in earlier stages than it was. And so when people still can do things today so that they can live full and healthy lives afterwards.
Interesting. I get you on the early detection, but I kind of just felt like because you have so much better treatments, that just the attitude towards, I'm asking because I'm just wondering if it affects Sharsheret, if the attitude towards cancer is seen as if cancer is seen as a little bit not terminal, not definite death, if the urgency for Sharsheret is seen as a little bit less. I'm just wondering if it affects.
I think almost the opposite, right? Because you get this crisis, you get this diagnosis. Nobody wants to hear those words. You have cancer. So what it could be is that you use Sharsheret, benefit from it now, but you don't have to use Sharsheret for 25 years. And you don't have to, Sharsheret's not preparing you for the end of life. Sharsheret's helping you get through it. How do I work through cancer? How do I raise my children? We give guidance on how do you talk to your kids about cancer? How do you establish healthy living? How do I eat with cancer? All these things that will help you improve the quality of life, lead to healthier outcomes, which are going to happen. But now you have a better chance with Sharsheret. So I think that it actually makes Sharsheret even more critical, because while we do focus on hospice and palliative care when needed, there are plenty of early stage cancer people like, I only need Sharsheret for a few things. And we're very happy with that. You come to us, you have one issue and that's all you need. Great. We get you. Sharsheret's about empowering people to take control of a situation where there's less control than they're used to. And so for some people, that's constant interaction with Sharsheret. And like you're saying, it's not that they need us less. They may have a more focused reason why they're reaching out to us. And then we empower them. We give them the tools to go off on their own. And that to us is tremendous success. And then they come back as volunteers and donors and referrals. Like they'll refer friends who need us. Oh, you were worried about that? Call Sharsheret. They can help you. You don't know which doctor to go to. They can talk to you about, these are where the women who are dealing with this kind of cancer, this is, these doctors are great. So we help them build their medical teams. Look, you're going to need a medical team, whether you have your cancer experience is a year or 6 months. We can help with that and what to expect. And we provide these kits that get you ready. So for example, if you're going in for surgery, we'll have a pre-surgery kit. If you're going in for treatment, chemotherapy, radiation, we'll give you a kit for that. You have little kids at home. Here's a busy box on toys for them, resources for you. You're going to have surgery. We'll give you a pillow that lifts your arms. You need this, you need to get in touch with home healthcare. This is what you do. So it's kind of logistics, the emotional piece, the psychosocial piece, and then they're on their way.
Mm-hmm. And we were going to ask you, like, for general stats, like it could be as simple as how many women do you reach every year, or how many women reach out to you every year, and what kind of impact do you see in these 5 communities in the U.S. and also in Israel?
So we've helped women one-on-one because we have on staff social workers and genetic counselors who are having one-on-one conversations with women and their family members. So we have about 37,000 women who have reached out to us individually. We know there are more because I'll be walking into Glot Express and someone will say to me, oh, I just want you to know Sharsheret was so great when I needed XYZ. First of all, I'll never confirm or deny because we're very confidential. But I'll say, this person never even called Sharsheret. And then how could we have helped them? And then I'll see them again. They're like, when I spoke to you is because I went on your webinar and I wanted a certain reconstruction for my breast cancer. And I saw this doctor. He was giving a session and I ended up going to that doctor. So really you helped me. But we don't have a record on that woman because, she attends a webinar, but I don't know if has a cancer experience. So we know that 37,000 women have gone through what we call this one-on-one with a social worker or a genetic counselor. We also do about 900 education outreach events, educating people about the statistics, and we're reaching annually about 275,000 people. We're on every college campus in the U.S. that has a Jewish presence. We're the national philanthropy for AE5, which is the largest Jewish sorority, and we partner with Hillel and Chabad. So all those students on campus are learning about the 1 in 40 carrying the BRCA mutation. They're learning about the importance of knowing their family history. We're giving them those tools. They're doing education events, outreach events, and fundraisers. So, and And in a year, we're speaking to about 8,500 women and their family members, but there's a multiplier effect. So if you speak to a woman, you could be speaking to their mother and their sister and their best friend and their spouse or their partner or their adult children or, the teacher at school or, can you talk to my doctor? Like, we'll talk to anyone associated with women. So you can imagine if each person has 5 people with whom that they are, that number grows. It's like, it could be 40,000. Yeah. So we're crazy busy all the time, which is, fortunately people are finding us, but unfortunately the need is there. Like I always say, I'd love to close up shop for lack of need. I think we'll always have a survivorship program, but, that would be the best news, that we're only here to help more people.
Actually, we should also give a shout out to Hannah Kirsch in your Teaneck office. She was our intern and we sent her off to you. So we feel like, shout out to strong women in the community who are giving back in the nonprofit world and like really did find a need and are working in a situation where, they're really appreciated.
Yeah.
Wait, so we're not getting Hannah back? Okay.
I know. We don't think Hannah's coming back. We're really bummed. But
okay.
She was our intern for a long time.
I want to interject. I have kids in shidduchim, so to speak, or getting married. Like, does this... I feel like it's interesting because they have the genetic panels, they have this stuff, but I feel like breast cancer is not really talked about there, but if we can test for it, it should be, I guess, in theory, correct? No, because it's on the X gene, right? It's really the woman's obligation to know her history in a sense, correct?
Well, the genetic testing for breast cancer mutations for both men and women. It's not, I'm saying you can pass it on to your sons and daughters and increases your own risk. So, the challenge with doing it, they do now offer, like I know J-Screen, we partner with J-Screen all the time and they do the prenatal testing. But we're talking about genetic testing for cancer. The recommendation is not to do it till you're 25 because there's nothing you can really do about it before 25. So when you were talking about in the Orthodox community, when people are meeting younger, it's when you have a mutation, a woman who carries a mutation has an 85% chance of developing breast cancer.
But you're saying mutation. I always thought it was a marker. It's a mutation?
It's a mutation.
Okay.
It's actually, it's a mutation. It's like a mistake on the gene.
Mm-hmm.
And there are like 3 founder mutations that are most common in Jewish families. And that's where we're seeing it.
That's BRCA1, 2,
yeah,
right?
BRCA1, there's only 1 and 2, but then there's CHEK2, PALB2, other ones, but they're not as high risk of cancer. So it's different than the prenatal because this is about you. Now, when you get to the children's situation, what we're seeing is that people who do carry the mutation are considering something called PGT, which is pre-implantation genetic testing. So if a family member, for example, we have a woman whose mother suffered terribly from breast cancer, and she inherited the BRCA mutation and said, I really don't want to pass this on to the next generation. What she and her husband chose to do was to do in vitro, not for fertility reasons, purely for screening the embryo for the genetic mutation, and then only implanted the embryos that did not have the BRCA, the BRCA gene mutation. So now she knows when her children are born with these embryos, she has basically cut off the gene from this family. So it was in this family for generations because of this new procedure. People are stopping the mutation in their tracks. It's not a perfect because you can end up with all the embryos having the mutation. And then what do you do? So that's just one way when it comes up in marriages. But I know that there is a concern, certainly in the ultra-Orthodox and Hasidic communities of mentioning a mutation because then it kind of puts like a negative mark on your resume. Mm-hmm. We're seeing in people can be private, people can be public. We're not here to tell you whether you should be private or public about it. So that's a decision that each person makes. And we do speak to people about when is the right time to tell your prospective partner if you already know. When is it, and what the statistics are. And we've had conversations with couples, and we've had couples who both families have had cancer, and they are trying to talk about like what their risk as a couple could be for the next generation. And this PGT idea has become very, very common, and many, many women are calling, and we have a peer support network. So our peer support network has all the women, but we have all these young women who are speaking to other young women on how they did this, when they did it, what their results were, what the challenges were, what the highs and what the lows were. And we have a specific program just focused on PGT. And so that couples, as they're considering family planning, who know their genetic status or are looking to find out how can they work with that. And so we're doing that. It's a big decision.
I found that fascinating. So these women are making a decision to screen their embryos. So
Women and their partners.
Women and their partners. I get it. Families or couples are making a decision to screen the embryos and to make sure that their unborn daughter
or son,
25 to 40 years in the future, will not have.
Well, they'll go out on the street, these boys and girls that are born with the same risk. So every woman has a risk of breast cancer. That is the biggest risk factor for breast cancer, but at 12% instead of at 82%. That's a huge difference. And so I think there's also this association, like if I pass it on to my child, is it my fault? But now, and look, it's obviously not your fault. But it's hard to reconcile that. And so this day and age, if it works for you, you can feel like I did everything I could. And if it, when we're supportive, and it's not perfect for everyone, but for those who are, they feel that they've done everything they can. There's only so much human beings can do. And then we know that there's a higher authority there. But
right. And to that point is as good as testing is, and as it gets better every year and every 5 years, I think it's just as important to say what isn't present in testing, and there's a lifestyle factor. There are a lot of different factors. Yeah. And also in the one thing I wanted to make a distinction of between the shidduchim testing, such as J-screen and stuff like that, they're testing for shared genetic mutations for the historically Jewish diseases. Am I right?
No, like they each test individually.
Right. But don't they do like You're
thinking of Dor Yesharim. Dor Yesharim is not where we don't work with Dor Yesharim. Okay. They don't do BRCA testing from what I understand. And the way they work, from my understanding, I'm not an expert on them, is that they don't tell you your results. They just tell you if you're a good match. When you go to J-screen, you get, which is really as an organization that is very much believes in genetic counseling. Okay. It's important to know your results because yes, it's important for your shidduch if you want to know, but for your own health, there are things you can do today. Like if you don't know the results and you don't know what you're at risk for, that is also a health risk. I mean, when we talk about the genetic testing, it's also important to keep in mind that there are limitations. And today, only 5 to 10% of breast cancer diagnoses can be attributed to a known genetic mutation. So there's still a lot out there that hasn't been discovered yet, but at least the ones that we know, we can take advantage of and treat accordingly. I mean, I think that's really an important statistic to understand, so that even if you test negative, there are other things going on that also people are going to get breast cancer who do not have a genetic mutation that we know of today. I mean, we have a family that every single woman in the family has had breast cancer. 3 generations going on, has in every study has not identified the mutation. They know they have something, and they're all doing extra surveillance to make sure. And there have been diagnoses. They've been diagnosed in early stages, and they're okay because they had it on their mind. They're talking about their family history. Right. So it's really important.
And pretty much every woman after the age of 45 has an annual mammogram.
So anyway. 40. So I think we should talk about the guidelines. Right. First of all,
he keeps getting younger.
Yeah.
But even at 25, a woman should really be going to an annual appointment with her doctor, and there are physical exams and conversations to have, and should know her family history. If a woman has a family member who is diagnosed with breast cancer, let's say a mom was diagnosed at 40 and the recommendation for mammograms at 40, that girl should start screening at 30, 10 years before the sister's diagnosis. And then if you have something called dense breasts, which you can't tell by looking or feeling, a doctor has to tell you that, you should be getting more than just a mammogram. We're talking about MRIs and sonograms. So, I mean, it's really important to know you don't miss your screening. I do remember doing a podcast a couple of years ago, and it was coming out of COVID, and people were like listening to a million things I said on this call. If there's nothing else you remember from today, because I spew out a ton of information, make sure to make your appointment. Mammogram, if you're a guy, you're supposed to check for prostate. Make sure you make your annual appointment. Do not push it off. And a woman was obviously listening. which was nice for me that somebody's listening. And she met someone who we knew in common and said, Elana Silber saved my life. And she said, Elana Silber? She's like, oh no, I have no idea who Elana Silber is, but she was on this podcast. And I didn't remember anything else she said, but when she said the one thing, and I said, you know what, it was COVID and I have kids and I'm busy and I don't have time. And she said, the one thing you can do after this is just make your mammogram. And she did. And they found cancer and they found it early and she's fine. So I'm never met her, don't know her name, don't even know where she's from, but we have a mutual connection. And I said, you know what? I feel like it was worth it. They say you save one life. And we know that what you're doing and having people on talking about this, you're saving a lot more than one life.
Thank God. That's beautiful.
Yeah.
And it's also really important too that I specifically remember my mammogram during COVID because there was a whole bunch of people in a group sitting really close together, wearing their masks and talking like crazy.
Look,
but it was like a social event because people didn't forget, most of them.
I mean, it was a scary time
Yeah.
when COVID hit and cancer screenings were closed and people were pushed off, and then to get the appointments later because
there was like a 3-month or so period where
and we saw the number of diagnoses go down, but we know that that's not because there wasn't cancer, it was that people weren't going. So it's really important. So I guess maybe I'll play the line again and just, if there's anything you do today, make your annual appointment. It's really important. And Sharsheret has a program where people get very nervous about a mammogram. It's the one place you go to find out if you have cancer. It's not really where you want to go. But Sharsheret has our social workers. They think, I can only call Sharsheret if I have cancer. No. But if you're going in for a mammogram, you're nervous, it's your first one, you're turning 40, or maybe you're going a little earlier and you don't want to bother your friends, call us. We'll talk to you through it. We have coping skills to get you through the mammogram. And sometimes they see things on a mammogram. So many women are like, they asked me for more pictures. And you're nervous, but you don't want to tell your friends or your sister because it's likely be nothing, but you're stressed. Call us because we speak to hundreds of women like that. This is very common and it's very normal and it's very upsetting. So why not use Sharsheret? Again, everything's free, everything's remote. You can do whatever and we'll get you through it. And it's okay to call us. You don't have to have cancer to call Sharsheret. We can help you just as you screen for it. It's stressful and we understand anxiety and there's something called scanxiety. It's a real thing. You're nervous about scans. Call us. We'll help you through it.
That's beautiful.
I've never heard that term. Wow.
All right. Well, I would say thank you for being with us today, Elana Silber, CEO of Sharsheret. We really
thank you for having us. I mean, I guess if anyone out there is concerned about breast cancer, ovarian cancer, you can really find us anywhere. We're on Instagram. We're called Sharsheret Official. We're on Facebook. We have a toll-free number, 866-474-2774. You can go to our website, sharsheret.org. There's some kind of live chat button. We text you, we call you, we make it convenient. It's and we have a quick turnaround. You call Sharsheret, we call you back. So we really want to hear from you. And you can also support us during October. It's an opportunity to fundraise. All the services that we offer are free. And we appreciate the opportunity. I know that the holidays are a time for tzedakah and Sharsheret is a tzedakah that can benefit probably every family that everyone's been touched by breast cancer, ovarian cancer. So thank you for having me and thank you for spreading the word. And we couldn't do it without people helping us like you and really appreciate the opportunity.
Yeah,
thank you.
We're happy to have you. Thank you.
Yeah.
Keep it up.
Thanks for being with us on the Jewish Link Pitch Meeting podcast. If you would like to participate or be in touch with us in any way, please email us at editor@jewishlink.news and follow us and find our podcast wherever you find podcasts.